All right, looks like we are about a minute past the hour. We can go ahead and get started. Hi, everyone, and welcome to How to Successfully Deliver Ultrasound Simulations and Their Benefits During COVID-19 and Beyond, Part 1, presented by SonoSim. Just a note that by registering for and viewing today's virtual learning lab, you agree to receive follow-up communication via email from representatives with SonoSim. This session is being recorded and will be uploaded to the online learning section of the SSH website later this evening. We ask that you keep your camera turned off and your microphone muted for the duration of this session. If this is your first time tuning into a virtual learning lab, note that these sessions will be held each Wednesday at various time slots during IMSH Delivers. You can view the list of virtual learning labs and register through the IMSH scheduler. And I will now turn this session over to Heidi with SonoSim.
Thank you for that introduction, Olivia. Happy New Year to all of you. We're thrilled to be joining you today to talk about how you can successfully deliver ultrasound simulations during this COVID-19 era. And with that, let's begin. Dr. Savitsky is a professor of emergency medicine and pediatric emergency medicine at the University of California, Los Angeles. As the founder and CEO of SonoSim, Dr. Savitsky is a pioneer in ultrasound education.
Great. Good morning, everyone. And Heidi, thanks for the introduction. Yeah, just really excited to be here with everybody at IMSH. And the topic here, we're going to break this morning's presentation down into several segments. And overall, what we want to deliver is the ability for people to really have a good appreciation in the simulation community of what it takes to successfully deliver ultrasound training using simulation in the era of COVID, and ideally, and hopefully sooner rather than later, in the time that follows. So one of the items I want to share and topics that we want to really discuss is what are the key elements that are required to develop ultrasound training competency. So we're going to spend some time really talking about what are the elements that enable someone to develop ultrasound competency. And then as a corollary, as a follow-on, what are the critical elements required to perform and enable ultrasound simulation that leads to ultrasound competency. We'll spend about 15-20 minutes delving into these topics. Then we'll do an overview of the Sonos Simulator, which is the key enabling technology that SonoSim has developed that helps facilitate ultrasound simulation. We'll subsequently segue to a case study that actually goes through how to use SonoSim Live Scan with Case Builder, and we'll actually do a live session of how you deliver remote ultrasound simulation in the era of COVID. And then we'll leave several minutes for any questions and answers with the virtual audience. So first thing to talk about and to really look at is, what has resulted in the big insurgence and growth in point of care ultrasound. And there's a variety of reasons, ranging from ultrasound machines becoming smaller, more portable, easier to use, better quality images, which at the end of the day puts ultrasound technology in the hands of care providers. For years, ultrasound has been, for the most part, for decades in the hands of radiologists. And as the ultrasound machines have become more ubiquitous, care providers, whether you're emergency medicine, critical care, OBGYN, general surgery, pediatrics, MSK specialties, whatever the specialty of medicine, physician assistants, nursing students, medical students, everyone has their hands on ultrasound machines. And the power of ultrasound machines, probably one of the studies that really underscores this. This was a study that was done at this point over 10 years ago. And it looked at if you had a series of medical students and they were given about 18 hours of very focused training on how to look at the heart with a handheld ultrasound machine. And then they looked at how well could they predict valvular heart lesions as well as non-valvular heart lesions. And they compared them to seasoned cardiologists, so cardiologists that have been practicing their trade for over 10 years. And what this slide clearly illustrates, all of the columns in blue are the medical students' accuracy. The columns in black are the accuracy of seasoned cardiologists for detecting non-valvular heart lesions, cardiac lesions. And then the p-values are the small numbers. So you can see that, everything from LVE, which is left ventricular enlargement, to LVH, which is left ventricular hypertrophy, a bunch of different parameters. You can see that the medical students overall outscored the cardiologists, despite the cardiologists being practicing their trade for over 10 plus years. The medical students outscored them sometimes by as high as 20 to over 20% in terms of accuracy. And it's the slide on the left, it's the difference of being able to see tricuspid regurgitation and being able to quantify it versus having to listen through a stethoscope and attempting to infer and translate what those sounds are to pathological lesions. And for a variety of reasons, that is extremely challenging. And this really does underscore the power of point-of-care ultrasound. So, what's the role that ultrasound has played in the COVID era? And what other benefits does ultrasound provide? So one of the major things that ultrasound really facilitates, so I've been in the ER 3 out of the last 4 days, and when patients come in, many times they have undifferentiated complaints. And when they come in with undifferentiated complaints, helping sort through the differential diagnosis of shortness of breath or weakness or abdominal pain, or when there's a critically ill COVID patient that need to do a procedure. These 4 slides really illustrate, 4 different ways, general ways that ultrasound, point-of-care ultrasound, actually can really facilitate patient care. So when you have someone who comes in with dyspnea, your classic COVID patient, they're hypoxemic, but they're not air hungry. Many times you're trying to decide, is this a patient that gets monoclonal antibody and can be sent home, or do they need dexamethasone and be hospitalized? So you're looking at their oxygen saturations. You're trying to see very quickly, and many times with limited resources, what's going on in the patient's lungs. There are characteristic findings on lung ultrasound that are consistent with COVID infection, which you see in the upper left, where you get focal subpleural consolidations or B lines. Those findings are highly suggestive of COVID infection. And then depending on the distribution of those findings, you can infer the severity in concert with looking at the patient and the patient's pulse oximeter readings. Many times, COVID coronavirus can affect the heart. So you actually can get primary cardiac dysfunction where the ejection fraction diminishes. You can have myocarditis, myocardial infarctions, pericardial effusions. And looking at the heart is critically important, both for a primary cardiac event related to COVID, or many times the stress of the infection can cause a secondary cardiac event, and being able to look at that at the patient's bedside is critically important. And then you can have a variety of gastrointestinal symptoms with COVID. So looking for other conditions that could mimic a COVID presentation, screening for bowel obstructions and a variety of other maladies of the hepatobiliary system is incredibly valuable. And then these patients very often are critically ill. You can see how close the carotid artery in this slide is to the internal jugular vein. And when you're navigating and trying to put a catheter and a large dilator and a large needle and a guide wire into the internal jugular vein, you can see how critically important it is to be in the correct area and not accidentally puncture the carotid artery, as well as putting in peripheral IVs, which negate or preclude the need to really put in a central venous catheter. So these are just some quick examples of how point-of-care ultrasound helps in the era of COVID. And then once again, the rationale for what's driving point-of-care ultrasound to be adopted by so many people. And a key barrier to that adoption is the training and simulation technologies that are used to educate people on ultrasound. As this slide shows, ultrasound is unique in that it's only as useful as the user's ability to obtain an ultrasound image, interpret the ultrasound image, and then subsequently take the findings and apply them to medical care. And this is what huge benefit of ultrasound simulation is. So one of the great contributions that simulation centers and simulation specialists can make to ultrasound educators is really helping facilitate how do you actually learn to acquire an image, how do you get the background knowledge of what to do with that image, and then how do you actually apply that and test how well people can apply that towards medical care. So those are all really key roles for ultrasound simulation. One of the things that we're focused on when we're trying to develop ultrasound competency is really making sure that each learner has all of the elements of ultrasound competency as they relate to what they're trying to do, whether it's looking at gallbladders or bladders or the heart or the lungs. These elements that you see on the screen are uniformly agreed upon by a large number of ultrasound specialists. There's been several consensus studies that have been performed, and there's pretty uniform consensus that irrespective of what type of ultrasound application you're applying, you should be able to apply and possess these fundamental elements that lead to ultrasound competency. And those are understanding why you're doing the exam, really understanding the knobology, how to actually operate the ultrasound equipment, how to acquire and optimize an ultrasound image, how to actually perform a systemic examination of whatever structure you're looking at, whether it's the heart or the lungs or the gallbladder, how to interpret those images, how to save those images in a way that, that can be used for medical billing, be part of the electronic health record, or serve as a quality assurance mechanism. And then most importantly, and then once again, this is a key element that ultrasound simulation can help with, is how do you actually take that knowledge and apply it towards medical decision making, which at the end of the day is what will improve patient care. So if ultrasound is so important and is being adopted so widely, why is it moving so slowly? And what's the role that ultrasound simulation and the simulation community can play in accelerating the adoption? So despite ultrasound being around for 50 plus years, it is still very, very slow to penetrate clinical medicine relative to its benefits. And the big challenge is the resources that are required to teach ultrasound, and as well to assess how well people have learned ultrasound and assess their competency. So the elements that are required to train someone in ultrasound is you need an ultrasound machine, you need a qualified instructor, you need a student, you need a patient with a pathological condition, you need a teaching moment where all of those things come together. You need to repeat until you achieve mastery. Then you need some way of assessing and documenting that someone has achieved competency. And then you need to plan for skill decay when someone may forget certain elements. And then you need to plan for refresher training and make refresher training accessible. And then this needs to be available for every ultrasound application, whether it's looking at the heart, for valvular lesions, or for tamponade, or for ejection fraction estimation, or looking at the lungs or the gallbladder, a variety of different applications. So you would need all of these elements for each application that you're trying to develop ultrasound competency in. So this really creates a myriad of challenges, which has slowed down the adoption curve and identifies some very clear areas that ultrasound simulation and the simulation community can really help accelerate the adoption of ultrasound and, importantly, improve patient care. So all of these elements we've kept in mind when we've developed the SonoSim ultrasound training solution and a suite of products that support it. So if you think about the previous slide, all of the elements that we talk about, we've looked to either primarily develop or subsequently develop as part of our ecosystem. So we have 70 plus courses that cover a variety of different topics, and they're foundational courses that teach anatomy and physiology. There's our core clinical pathway that teaches pathologies and very relevant to people that are seeing patients as opposed to potentially students earlier, medical students, nursing students, PA students earlier in their educational cycle. There's advanced courses, which are great for fellows and people wanting in-depth training. And then we have our procedure modules, which teach how to do ultrasound guided procedures. So there's 70 plus courses, all cloud-based and supported with mobile applications. So really support remote learning and remote access to the courses independent of location. What you see on the screen is the Sonos Simulator. We'll do an in-depth review of what the Sonos Simulator provides, but in a nutshell, you can take a probe, plug it into a USB port, and have your own independent ultrasound training platform where you use real patient cases and you're able to scan through them. And once again, this provides pathology on demand. You could take 5 years of sitting in an emergency department or an ICU and imagine all the cases that you see, and you have them on your laptop on demand, and you can go through them in several weeks or several months, depending on the depth of training and knowledge you're looking to acquire. So a really, really powerful tool that lets you scan real patients on demand and not have to wait for pathologies to come through the door. And then as a simulation center director, you need to manage your users, whether it's 1, 10, 20, 100, or even 1,000 users. You need the ability to facilitate making assignments, tracking how well users are doing, facilitating ultrasound educators across different specialties. And then most importantly, someone, including all the people that use the simulation center for ultrasound training, they need to be able to track how well people are achieving competency. And there's some really powerful tools that we'll present that allow ultrasound competency assessment and automated assessment using rule-based AI technologies that SonoSim has developed. One of the other products that we have that we'll demonstrate is SonoSim Live Scan with Case Builder. We'll do a remote simulation using SonoSim Live Scan with Case Builder, and this is an incredibly powerful tool that allows us to use SonoSim Live Scan tags. They can be put on people or mannequins, and you convert that person or mannequin into patients with a variety of different pathological conditions. You can make a bunch of different scenarios. This can be done remotely. And this, most importantly, is where the ultrasound simulation community can facilitate how do you test and assess how well people can take ultrasound findings, acquire an image, and then apply that towards medical decision-making. And finally, ultrasound guided procedure training. You have a bunch of diagnostic ultrasound applications, and then you have therapeutic or image-guided applications. And SonoSim has a variety of different procedures, everything from fundamentals of doing ultrasound-guided procedures to how do you do peripheral IV access to central venous access, whether it's internal jugular, subclavian, femoral, and there are a variety of critical procedures such as pericardiocentesis, paracentesis, thoracentesis, as well as a variety of musculoskeletal injection and aspiration procedures of the major joints of the body. These are all done and taught in a cognitive training module format that we'll demonstrate shortly. So these are all the elements that are put together that are intended to overcome the previously mentioned barriers to ultrasound education training. Once again, this is a quick screenshot of a user being able to access the courses remotely through any internet-connected device. You have a mobile application, which is really important, that allows refresher training and can serve as a bedside reference tool for people. And then once again, all of these modules come with tests and test questions. So there's in-module questions that help reinforce learning after several concepts are presented. And then there's a mastery test at the end that a simulation center administrator or an ultrasound educator can access and see who's achieved competency based on the didactic knowledge presented and be able to track and provide feedback to users based on their didactic knowledge performance. Once again, this is the Sonos Simulator and provides the real value of using the fanning, rocking, and tilting motions. You select the image windows. So you click on a particular image window, either on the body or on the Sonos Simulator. The probe moves to that image window. And then once you're at that image window, the exact fanning, rocking, tilting maneuvers that you would do to acquire that image, you actually have to recreate with the SonoSim probe, which has a built-in motion sensor. There's a virtual tutor that allows instant feedback in terms of image acquisition. There are findings videos narrated by ultrasound experts that provide feedback to the learner. And then most importantly, you can access a variety of different pathologies on demand 24/7. This screenshot shows the SonoSim Performance Tracker. There's a variety of different applications and features within Performance Tracker. Beyond just assessing how well someone does on didactic knowledge, there's a variety of curriculum integration tools. You get feedback immediately on the images that you've saved, and you can provide, as an administrator, feedback to the learners. There are sample assignments that actually take someone through and ask them to apply the exact most important image acquisition tasks that are taught in each course. And as someone goes through the sample assignments, which there's one for each course, there's automated assessment powered by AI that will assess how well does someone acquire an image relative to the optimal view as established by subject matter experts. And that is done in an automated way and has huge benefits because the amount of time and energy it takes to review all of that information can be a huge time sink. And then this is a couple screens here that illustrate in the pre-COVID and hopefully post-COVID era, minus the masks, how SonoSim Live Scan can be used to run both in-person or remote. And then importantly, in the era of COVID, we have a dedicated session today that will show how you can use SonoSim Live Scan to execute remote ultrasound simulation and teach how to take ultrasound and integrate it into medical decision-making. And then in the post-COVID era, when live in-person sessions come in, you can use the same exact technology to apply SonoSim live scan tags to a person or a mannequin. You can create cases, or your ultrasound educators can create cases, import the pathology into these respective windows, and create a variety of different medical scenarios. And with Case Builder, literally create over 1 million different case combinations that can teach and assess how well can people integrate ultrasound findings towards medical decision making. Real quick overview of our automated assessment powered by AI feature that we're launching in 2021. Very excited about this. So once again, this provides the ability to assess how well someone achieves didactic knowledge mastery. Then people are given the module assignments, and you can see how well they're able to acquire, interpret, and execute a series of tasks. And they do that by going into the Sonos Simulator. This can be done remotely or can be done within a simulation center or a combination thereof. And then the AI automated assessment tool goes in and sees how well did they successfully execute the assigned tasks in the module assignment. And once again, this can save tons of time. So educators can use their time to provide guided feedback, focused feedback, and also feel very confident that all the learners have a very strong foundation of knowledge. So this literally can save tens of hours, if not hundreds of hours, when you start to get upwards of 100 students that need to be tested on a variety of different ultrasound concepts. This is a screenshot of SonoSim Live Scan with Case Builder. This is the interface, and this is a screenshot where our team will be providing an overview of how you can use SonoSim Live Scan with Case Builder to create over 1 million types of cases, create scenarios, publish them, and then remotely run a SonoSim live scan session and really have a team-based environment, even though it is done remotely in the era of COVID. So we'll have a dedicated session that will discuss this. And then ultrasound guided procedure training. Once again, we use a cognitive task training approach to have someone learn the didactic knowledge required and then learn the procedural knowledge and execute the procedural steps to perform ultrasound guided procedures across a variety of different applications. All right, in closing, we're going to segue now, and we're going to take about 5 minutes to discuss the Sonos Simulator. So we'll join you shortly, and we'll take you through a demo of the Sonos Simulator on several really common scenarios that people would be using either within the simulation center or facilitated by simulation centers and performed remotely. So we'll see you in a few minutes. Thank you. All right, great. Good to be back with you guys. So I've got my SonoSim probe in my hand. I'm in a remote setting hooked up to an internet connection using a PC. And what I'm going to demonstrate here is the Sonos Simulator and a little bit of all of the features and the value. So here we've got a case list. You can see there's 101 modules to pick from. I am going to scroll through. First case I'll demonstrate is a renal case. I'll load case number 10. And here you get the case history. So I'm just going to take you through the workflow. So real patient, 30-year-old female with a history of kidney stones and allergies to NSAIDs, presents complaining of right flank pain, inability to void. We're asking the user to use sonography to acquire an image of the kidneys and the bladder and see if they see any pathology. So the movement I do with my hands is I fan through the kidney, the corresponding real ultrasound image appears. It looks like there's some high density calcification, maybe an intrarenal stone here. Here I see some anechoic areas within what should be hyperrenal sinus fat. And this looks like mild and moderate hypernephrosis. I can reposition a patient to a variety of different body positions based on my scanning preferences. Here I'm going to leave her in an oblique position. And as I scan through for learners, it's really important for them to have an appreciation. As you fan an ultrasound transducer through the body, you can see how a variety of different image slices translate to an ultrasound image. We also have a tool that when it was relevant, patients underwent cross-sectional imaging. Here, the same patient underwent a CT scan. So the learner can understand how the probe and the transducer beam transects through the body, how it translates to an ultrasound image, and how that translates and correlates with a CT scan image of a kidney hypernephrosis with a spine with the liver and Morrison's pouch interposed between the two structures. So really valuable. As you're learning, you may not know, I'm going to put the probe in an unnatural position. I may not know how to get a long axis view of the kidney. And what SonoSim provides is a probe guide. So this probe guide If you align, it gives you a chime, gives you a green signal, and this tells you that you've gotten a long axis image that correlates with what our expert thought was the optimal image view. If you didn't know how to get a short axis image, you can put a short axis guide. And if you don't align correctly, I'm flipped 180 degrees, it doesn't tell me I'm in the correct position. But here, if I orient correctly, it tells me I've got the optimal short axis view as determined by expert. In addition to this, you're able to access our findings video. So here you're going to hear an expert narrate the findings as I scan through. Here a pop-up window appears, and you're going to hear
curved abdominal transducer to scan the right kidney of this 30-year-old female patient who presents with a history of multiple kidney stones and inability to void, cavity to NSAIDs, and right flank pain. We see the liver all around the right kidney, and right away we notice how prominent the collecting system looks. And this is more consistent with a mild to moderate hydronephrosis.
So here you have the ability for an instructor to be with you 24/7, remotely or in person, that can actually help narrate what you're seeing. As a system administrator, you can put things into test mode, and when you put test mode, certain features like that findings video or the probe guide are inactivated, so the learner cannot use them. So this is if you were in a testing situation, you could deactivate those features. You have caliper functions that allow you to do a variety of caliper measurements. So if for whatever reason you wanted to do a diameter measurement, you can take the caliper, you can get a diameter of the kidney, you can freeze that image, you can save that image, you can annotate that image, and then you can review it subsequently later based on your preferences. So really, really powerful tool. You can change the gain function, increase gain, decrease gain. You can change the depth settings. You can flip the indicator based on your imaging convention. So a variety of tools and functionalities, including Doppler and different calipers that are relevant for the topic. You can move from image window to image window. So here I move into the bladder view, and I can scan through the bladder in a sagittal plane, in a transverse plane. Now I can select to move over and look at the anatomical left kidney. Here I fan through that. I can change my body position if I prefer. So I have a better understanding of exactly kind of how the probe is positioned and see if there's any pathology, and there is none there. So nice example of how you can use SonoSim to learn how to acquire images as well as interpret them 24/7 remotely, have access to thousands of cases with expert instruction. Here, we'll show you a different example. So we'll go into OB and another area, a variety of different OB cases. But if we go into first trimester pregnancy, we'll pull up case 10. We'll read the case history. A 31-year-old after an MBA complaining of abdominal pain, and we're asked to assess her uterus and her fetus for viability. So we can pick a suprapubic view, a uterine body view, or a fundal view. We'll pick uterine body to start with. And as we fan through here, immediately what you see is you see the bladder, you see a pregnancy, and then if you look really carefully, you can see cardiac activity here. So remember we talked about there's a variety of different tools. So I feel good that I see cardiac activity. I'm going to freeze that image. I'm going to use my calipers. I'm going to go to OB. I'm going to use fetal biometry in the form of crown rump length. And I'm going to measure from crown to rump. And I'm going to see that this is an approximately 10-week live intrauterine gestation based on the fact that I can see fetal cardiac activity. Once again, we can remove layers to see how the probe goes through the bladder as well as the uterus to acquire these images. I can move the probe up higher and look at the fundus. I can move over here and scan the right adnexa. I can scan over here and move to this image window. And once again, the fanning, rocking, and tilting, all these hand movements are the key visuomotor, visuospatial skills that you need to develop, the hand-eye coordination that users need to develop using real pathology and real pathological images. Another feature, you can literally use the same tools, the same probe, put a transvaginal adapter on, and now I'm actually removing a layer button in terms of functionality, so you can actually see where the probe is. This is a transvaginal ultrasound in that same exact patient. As I fan over here, I'm going to be able to appreciate what looks like a fetal yolk sac, and it's connected to the amniotic sac. And within the amniotic sac, I see that uterus. And if I fan through, I'm able to see fetal cardiac activity right here. And I can once again use fetal biometry if I wanted to. But here, using transvaginal ultrasound, I'm able to get a much better defined view of the amniotic sac and of the fetal yolk sac, all images that I would not have been able to appreciate if I was just reliant upon abdominal ultrasound. So here's another example of the Sonos Simulator providing access to a variety of different pathologies. One other thing that I wanted to highlight really quickly is the cognitive task training modules for ultrasound-related procedures. This is critically important. And once again, we have a variety of different procedures that we can teach. Here, we're actually going to be teaching how to perform internal jugular vein cannulation. So I'll load a case, 42-year-old male requiring a central line. Please use ultrasound to perform the procedure. So here I'm doing my survey scan where I'm scanning through the anatomical right neck. I see two structures. I can use my Doppler and see that this is phasic flow, this is pulsatile flow, so this is more consistent with venous flow versus arterial flow. I can use my compression button down here, and I can see that the vein collapses completely as opposed to the artery, which does not. So this is my target. I'm going to move into procedure scan mode, and I'm going to select advanced user from my bar down below. And once again, I can change body positions. I can have the expert findings video narrate the anatomy if I need. But my first step is I'm going to align my target structure, which is the vein. And I'm going to put the vein right down the middle of the screen. So vein is here. Next, I'm going to click the needle. I'm going to position the needle right in the middle of my probe. I'm going to put it adjacent to my probe. And now I'm going to change my entry angle. You can see here, right over here over the left lower bar, it will tell you the angle. I'm going to drop to about 45 degrees. And I'm going to attempt to use out-of-plane needle guidance to guide and walk the needle into the internal jugular vein. So here I'm going to fan towards the vein. I'm going to start to advance the needle, and I'm going to look to see if I can identify the needle tip. And I see the needle tip right there, right on my needle screen. I'm going to fan the probe away till it disappears. Now I'm going to advance the needle. I'm going to fan my probe away till it disappears. I'm going to advance my needle. I'm going to fan my probe away till it disappears, the needle tip. I'm going to advance my needle. Now I know I'm in the vessel, and I've quote unquote walked the needle in using out-of-plane guidance. Because of the artery being posterior, I'm going to rotate into in-plane guidance at this point. This is a critical step. I see a lot of learners, novice ultrasound users, they're much more comfortable with out-of-plane guidance, but they do not have the dexterity, the hand-eye visuomotor skills, the psychomotor skills required to go into in-plane guidance, which is critical to making sure you do procedures safely. Here I can guide the needle tip in using in-plane guidance. I'm going to purposefully go through the back wall here of the vessel. I'm going to go through the back wall, and I'm going to get near the artery. Then I'm going to back the needle out. So I'm going to pull the needle back, get back in the vessel. And here is where we have our automated assessment with AI. It's tracked everything that I'm doing. It's going to tell me you've cannulated the internal jugular vein. However, earlier you traversed the border of the internal jugular vein. So it's caught that I did the procedure incorrectly, and I can try again. Once again, this entire process was done without an instructor looking over your shoulder, without needing to actually stick the needle into a patient. So incredibly valuable. And once again, we have a variety of different procedures that we can apply this to, and a variety of different learning opportunities. So you can learn how to do a pericardiocentesis, where you can literally use the same technology. Here in a peristernal view, I can see what looks like a very moderate to large pericardial effusion. I can view it through a variety of different views. Here I look at it through an apical four-chamber. Here I look at it from a subcostal perspective to confirm that indeed it is a large pericardial effusion. And then here I can actually attempt to do a pericardiocentesis using the same techniques with the probe, with the needle, or I can choose to try to do it from an alternative approach using a phased array transducer. So a variety of different procedures using cognitive task training modules to really make sure people have the didactic knowledge, procedural knowledge, and most importantly, know the physical steps that need to go through to be able to successfully perform a procedure. This can be done remotely, and when they come into a simulation center in live instruction, they can try to do these on physical mannequins with needles, but they've got the advantage of acquiring the knowledge and the procedural skills and the cognitive steps to be successful. And most importantly, they can practice on real patients, real patient pathology, and really learn ultrasound anatomy and be able to apply that towards performing a procedure. And then come in when they learn on synthetic 3D printed molds, they can further refine their expertise before actually practicing on a patient or performing the procedure on a patient. So I appreciate your time. We're going to segue now into a section that really goes through SonoSim Live Scan with Case Builder and focuses on how can you actually use that technology to see how well people can apply medical knowledge towards medical decision making, and how can that be done in a remote setting, which obviously is critical in this COVID era and can be used in that time in the years that follow. Appreciate everybody's time and attention today.
Okay, thank you, Dr. Savitsky. I see that some of you are asking some questions already, which is wonderful, and Dr. Savitsky is answering them as we go along, but we will have a dedicated Q&A section after this portion. Next up, SonoSim Product Manager Eric Siri will walk us through how to run a remote ultrasound simulation with a practical video example that includes a facilitated virtual simulation of a COVID-19 rule-out patient. Okay, let's set that up. Give me just a moment, please.
Hello everyone, my name is Eric Siri, Product Manager here at SonoSim. Today I'm going to show you how SonoSim is helping sim centers and ultrasound educators stay connected with their learners by using a flexible suite of ultrasound training tools that allow for remote learning and live instruction. I'm going to show you how you can use SonoSim Live Scan with Case Builder to run remote simulations. SonoSim Live Scan allows you to teach your learners to integrate ultrasound findings into their medical decision making by letting them scan real patient ultrasound data sets with real pathology, such as this case that demonstrates echo findings consistent with cardiac tamponade physiology. To run your remote simulation, you'll need 4 things. 1, your SonoSim Live Scan tags. 2, SonoSim Live Scan Pro. 3, a computer. And 4, a mock ultrasound patient. If you are in a sim center, you can place the SonoSim Live Scan tags on any mannequin. Otherwise, you can place them on a live volunteer. You can even place them on yourself. You can even place the tags on a stuffed animal, like my friend here. With SonoSim Live Scan, all of these can be instantly transformed into an ultrasound training patient with pathologic conditions. Next, you will need to choose a case. SonoSim Live Scan has a large selection of pre-built cases broken up into categories: trauma care, critical care, cardiac resuscitation, genitourinary, hepatobiliary, ocular, early and late stage pregnancy, and neonatal and infant neurosonography. Each case has a patient history, as well as videos describing each ultrasound window in detail.
We do see that this is a large pericardial effusion, and I think we're seeing diastolic right ventricular collapse. Let's see what happens as the movie starts rolling some more. Notice what's happening to the apex of the heart. It is moving everywhere. This is a swinging heart.
If you don't find a pre-built case that meets your training needs, you can create your own using SonoSim Case Builder. With Case Builder, you can pick from different imaging windows with pathology and create over 1 million unique training cases. Simply choose what kind of pathology you want your training case to have. For instance, if you want to simulate the sonographic assessment of a COVID rule-out patient, you can select lung windows and look to identify relevant pathologic findings, such as B-lines or focal or diffuse consolidations. Once you have added all the windows for your remote simulation case, you can add a case title, a case history, and then access it in SonoSim Live Scan. When your case is ready, start up any video conferencing software, and you are ready to start your remote simulation. Hello everyone, it's good to see you. Glad that we're able to join each other remotely here for this remote simulation using SonoSim Live Scan. Have a COVID-19 rule-out patient for you all today. You can see the history right there. This is an elderly nursing home patient. History of diabetes, hypertension, presents with fever, cough, and hypoxemia. You can see the vitals right there. I'm just going to ask you to tell me where to scan. I have the SonoSim live scan tags on me, so I'm going to be scanning myself. So let's start with Jess. Can you go ahead and tell me where you want me to scan?
Okay, so given that this patient has a cough, can we start with the lungs? Let's start with imaging the right lung. Okay, so we're seeing multiple B lines here. Can we use M mode? Can we turn on M mode to confirm lung sliding?
Okay.
So it looks like positive lung sliding. Let's move over to the left lung.
Okay.
And turn into transverse, please.
Sure.
So again, seeing multiple B lines here. Could we look at the heart next from the peristernal window? So it seems like there's normal left ventricular ejection fraction and overall cardiac function.
Okay, so based on what you've seen, what are you thinking that this might be?
Well, in the context of an elderly nursing home patient who's presenting with fevers and cough, it could be consistent with diffuse alveolar interstitial syndrome, which could also be suggestive of widespread involvement of both lungs due to COVID-19 infection. Alternatively, another viral pneumonia could be the explanation.
Okay, and what makes you think it's not pulmonary fibrosis, CHF?
It could be, but based on the clinical context and the normal limited echo findings, it's less supportive of those etiologies.
Okay, so as you saw, Jess did a great job there. She identified the B lines in both lungs. She saw that the heart was normal. So do you have any questions, anyone? All right, we'll go on and move on to the next case. We hope this has been helpful for you. If you have any questions on how to integrate SonoSim LiveScan and Case Builder into your training, please let us know.
Okay, thank you, Eric Siri. Well, now we will open it up to questions from the audience. Like I said, I already see some questions popping up, and some of the Dr. Eric Savitsky and Eric Siri are on standby to answer everyone's questions. And for all attendees of today's webinar, you can access a complimentary trial of SonoSim. Just email us at info@sonosim.com and we'll provide a trial of our SonoSim courses and the mobile app. And with that, we're going to open it up to questions. Dr. Savitsky and Eric Siri, are you both on?
We are, Heidi. Thanks.
Okay, wonderful. I do see there was a question here. Tom Cal had sent me a private question asking, are the OBGYN was a real ultrasound image? To which we replied, yes, all of our ultrasound images are from real patient cases. I don't know if you wanted to expand on that a little bit, Dr. Savitsky.
Yeah, I'd be happy to. Yeah, so all of the cases that are included are real patients that consented and provided the images in a HIPAA-compliant, de-identified way. So all of the patient pathology is real patient-based, including the OBGYN question.
Okay. We have a question coming from Kathleen McCarthy. She asked, we have multiple residencies using SonoSim modules and have LifeScan. How can we get them more engaged in using LifeScan post-COVID?
Yeah, that's a great question. I think as each specialty evolves and the criteria and the parameters that you used for ultrasound competency continue to go up, there'll be progressive interest from all of the specialties in terms of ensuring that their residents and that their learners can actually take the ultrasound findings and apply them towards medical decision making. There's a there's a real emphasis on picking up a probe and starting to scan, but the real challenge is not just acquiring an image, it's actually knowing how to use it. So in answer to your question, Kathleen, it's just letting the different residency programs be aware of the tools that SonoSim provides. And in order to, at the end of the day, improve patient care, which is what we all care about, you need to have background knowledge to know how ultrasound can help. You've got to have that image acquisition and image interpretation ability. And then where simulation centers can really, really help is both in the era of COVID and beyond. There's a variety, as Eric Siri had pointed out, literally millions of different scenarios that are applicable across all specialties. And this is where the professors and ultrasound educators can really use their knowledge to craft their own customized cases and integrate them into their own curriculum and really see whether their learners can actually take images they've acquired and interpreted and apply it towards patient care and ultimately improve outcomes. So I think it's just letting people be aware of all the tools, letting them be aware of the customization, and then just getting them used to using the software remotely in the era of COVID. And then when live instruction returns, or when there's a combination of approaches, it easily and seamlessly can be executed in a simulation center live environment. So it's a pretty seamless transition. So I think it's just letting people be aware of the tools, the functionality, and then importantly, the ability to customize the offering to their individual training program requirements.
Perfect. I believe Kathleen had also asked a question. I'm going to go back just a little bit. In the chat, there were already a couple of questions that were answered, but we're just going to revisit them before we move on to the newer questions. Kathleen's question was, so with AI assessments, will that automatically score with feedback on the scanning cases in SonoSim?
Yeah, and I'll be happy to revisit that and just go through the chat box. So the AI assessment version 1.0 will provide feedback regarding whether an acquired image is acceptable, unacceptable, or indeterminate. With respect to acquiring an optimal image view is determined by ultrasound subject matter experts, and image depth and image optimizations such as gain will be similarly assessed and reported. The cases that will be assessed come from each SonoSim module and sample assignment that tasks the learner with executing critical tasks that are taught in corresponding SonoSim courses within each SonoSim module.
Fabio Rincon asked, is it available in other languages, Spanish?
Yeah, that's a great question. It's an area of active development for us. So we've been very fortunate and are using a lot of AI-based advances to accelerate our localization. Spanish is one of several languages that we'll be looking to localize and roll out over the course of 2021 into 2022. It is currently not available, but we are hopeful to over the next year and a half, start to roll it out. And Spanish is one of our top languages that we will localize to.
Wonderful. Next question comes from Lillian Emlet. She asks, do you have data on if beginner learners use the modules for lung cardiac cases, then go to real live patient scans, that they are able to obtain adequate images quality and interpretations in a QA process?
Yeah, no, it's a great question, and a big emphasis for us. We started as when SonoSim started, we were an SBIR funded company, so there was a lot of validation studies that needed to be done by third-party academic partners as part of our initial grant. So one of our first initial studies actually took two arms. It took an arm that was a medical student arm taught by a live instructor how to perform a fast scan. The other arm was taught through the Sonos Simulator. And we were equivalent to the live instructor in terms of how well we taught the students to acquire images. And then the students who learned through the Sonos Simulator actually outperformed the live instructor arm on being able to interpret ultrasound images. And at this point, there's probably 20 plus peer-reviewed studies, abstracts, presentations, and they validated every pillar, every foundational pillar, whether it's the SonoSim courses, the Sonos Simulator for a variety of the different applications, whether it's SonoSim Live Scan, or the metrics that we use for our automated assessment tools and functionality. So there's a rich library that's been, for the most part, published by third parties, academic researchers from a variety of different countries and a diverse setting and groups of learners. And the SonoSim marketing team would gladly provide the links, citations to those studies to anyone that's interested.
Thank you, Dr. Savitsky. And our last question comes from Lilia Chavaria. I have SonoSim, but my software does not include CT and 3D images. How can I attain updating the software?
Yeah, great question, and it's our own shortcoming for not letting you and people know that it probably exists when it does. So when you look into the kind of SonoSim ultrasound user interface, when you see the ultrasound images, there's basically one button there that allows you to shrink the screen or expand the screen. And when you expand the screen, if there's a corresponding CT image, MRI image, plain film, Doppler clip, it will play. So that functionality exists, and it's in the Sonos Simulator graphic user interface. And if you hit the button, it's along the left side, left column, that will expand. Not every case has a corresponding CT image or MRI or X-ray, but when it was clinically relevant to the patient's care and we captured that and we thought that it added additional learning, we did do co-registration of the 3D image set so you can see how an ultrasound image correlates with patient anatomy as well as CT anatomy. And then many times, whether it's plain radiographs or addition Doppler clips and functionalities that contribute to learning, that exists. So that functionality should exist already. If not, feel free to reach out to our support team and we'll make sure we get you upgraded. But that has been long since been in our product for many versions, but many learners just don't know how to access it. And it's accessible through the expand drop-down menu, which is a button that you can see in the ultrasound graphic user interface.
Great. And then we do have one more question from Randall Anderson about our tags. Randall, feel free to unmute yourself and you're welcome to ask Dr. Savitsky.
Okay, I apologize if I missed an explanation of this, but just as far as the tags, I was wondering about a little more practical details of how they work. Are they adhesive? Does the adhesive wear off? How are they attached? Does the probe have to be on top of the tags to work, or is it just? But does that just basically set it to that program? And then what happens if you lose the tags? Have you lost the module if you lose the tags?
Perfect. I'm going to turn it over to my colleague here, Eric Siri, to answer that. So the tags represent image windows. So and each tag has a corresponding image window, and those correspond with functionally where you would put the probe. But Eric, if you want to answer the question, that would be great. Turn it over to you.
Yeah, thank you for the question. So yeah, the tags work with RFID technology. So when you put the probe on, it will know which window you are on and show that image. They do have adhesive. And with the purchase, you get two different types of tags. You get ones that are used for live volunteers, human volunteers that have hypoallergenic adhesive. So one-time use, you could take them off after and they won't create any allergic reaction or anything like that. And then there's also a set of semi-permanent tags that are meant for mannequin use. The idea of these is you put them on and you leave them on and they stay on your mannequin as long as you use the mannequin. So two different types of tags for the two different applications. If for some reason a tag gets lost, we do have replacements available for purchase, and you can get your simulator back up and running. I think that was everything you asked. If there's something I missed,
do you have to have the probe over the tag for this to work, or is it just a way to, once you get the tag, can you go outside of the borders of the tag and still rock and tip and stuff?
Right. So you do have to have it in contact with the tag, and the idea is, right, we're trying to simulate actually scanning the patient. So the idea is if you move off the window, which would be in this case moving off the tag, you lose your image. So we're trying to teach people to stay on the window, and as they're fanning and rocking and doing all that, maintaining the position of the SonoSim probe.
Yeah.
So how does that relate to the blue pad that you showed at the beginning of the video? Then, how do those two different things relate?
Yeah, I can just jump in there. It's a great question. So there's the scan pad where there's an individual user. And that's just basically a kind of a home base that allows someone to rest the probe. And then there's the SonoSim tags, which you apply to either a person or a mannequin. Were you alluding to the tags themselves as part of SonoSim Live Scan, or was it the scan pad question that you had?
Well, both things. What I'm wondering is, are there SonoSim programs that work without the radio frequency tags then, that you can just use the blue
Correct.
pad with? Okay.
Yeah, once again, the ecosystem consists of 5 different elements. So there's the SonoSim courses. So people can access that through a mobile phone, through any internet connected device. So the courses are 24/7 access through any internet enabled device. Then there's the Sonos Simulator, which any individual user can access anywhere using their laptop, or it can be within a simulation center environment on PCs. And that uses the scan pad, does not require SonoSim tags, does not require a mannequin or a person. And then there's SonoSim Live Scan with Case Builder, which really helps teach, assess how well people can apply ultrasound findings towards decision making. And that is typically enabled by applying the tags to a person or a mannequin. And then there's the SonoSim Performance Tracker, powered by AI, that really is a program administration function. It's pure software, 24/7 available, cloud-based. And then there's our procedural modules that are the cognitive task training modules. And once again, those can be accessed by any user connected to an internet connected device via a PC or a Mac.
Thank you so much. That was very helpful.
No, you're welcome. You're welcome.
All right, and the last question for this session comes from Danielle, and she asks, does SonoSim help simulation centers address all types of specialties?
Yeah, it's a wonderful question, and it overlaps with, I think, what someone had asked earlier, perhaps in the chat. Yeah, one of the things that we pride ourselves on is we really started with a initial focus in point of care ultrasound. And as you all well appreciate as ultrasound educators and simulation center directors, is your ultrasound learners and point of care learners, they transcend all specialties. So at this point, we have 70 plus modules, and they are organized in a way that, depending on the level of depth, instruction, and rigor a particular specialty wants to instruct their learners, they can teach anatomy and physiology, which is one group of modules. That's perfect for medical students or learners that really want a strong foundation. You have core clinical, which at this point has at least 17 different topics. And this is when you introduce pathology. You have our advanced clinical modules, which really go into great depth and on cardiology and a variety of OBGYN topics. And then we have our procedure modules, which at this point cover a variety of different procedures performed by multiple specialists. So in a nutshell, every point of care user that uses ultrasound, I would say about 85% of the applications to 90% of the applications are covered within the SonoSim library. And the areas that we continue to develop are a variety of musculoskeletal joint injections, as well as pathologies and nerve blocks. So those are the last 10 to 15% of commonly used point of care applications that we're in the process of developing and continue to roll out. And depending on the package, you instantly get it as soon as it's published within your simulation center or a residency program. And for the most part, I think we cover the breadth of point of care users across all specialties.
Okay, and with that, we're going to close this session. Thank you to both the Erics for their presentations. If we didn't get a chance to reach out and answer all of your questions, as I said in the chat, please feel free to email us directly at info@sonosim.com, and we'll certainly respond to your questions promptly. And a reminder that, yes, you can access a complimentary trial of both the SonoSim courses and the mobile app. And thank you for your time.
Great. Thank you, Heidi. Thank you. It's a pleasure being with everyone.
And with that, I'll turn it over back to Olivia.
All right, thank you very much. SonoSim, I went ahead and posted in the chat the link where the recording will be posted in the event that anybody would like to refer back to the recording. And I appreciate you all for joining us at our Learning Lab. Take care and have a good rest of your day.
Thank you.